Across India today, almost every family knows someone living with diabetes, a condition often linked with obesity, hypertension, heart disease, or kidney problems. This message is for every patient, every family member, and everyone who wishes to reclaim good health. What was once considered a disease of middle or old age is now being seen in younger adults and even teenagers. India today carries one of the largest burden of diabetes in the world, and that reality makes awareness and action more urgent than ever. If our nation is to become truly healthy, we must dream beyond treatment. We must work together for a diabetes-free India. And the first step towards that dream is understanding the science behind the disease. Most people try hard. They reduce sugar and rice, avoid sweets, and start walking. Yet, their blood sugar levels refuse to stay normal. They take medicines faithfully. Some even use insulin injections, but the disease continues to progress. Every hospital visits add new tablets or higher doses. And many quietly accept that they will need medication for life. If that sounds familiar, remember this. Your efforts are not in vain. They have only lacked the scientific precision needed to match the depth of your condition. Understanding that science can change everything. There are two main forms of diabetes, type 1 and type 2. Type 1 diabetes occurs when the pancreas stops producing insulin because its insulin making cells are destroyed. It affects roughly 5 to 10% of people with diabetes and requires lifelong insulin replacement. The other 90 to 95% have type 2 diabetes. Here, the body still produces insulin, often in large amounts, but the cells stop responding properly. This is called insulin resistance. As both glucose and insulin levels rise, blood vessels are damaged, leading to heart disease, kidney failure, vision loss, hearing loss, and nerve damage. Type 2 diabetes is therefore not merely a sugar disorder, it is a metabolic disease born out of modern lifestyle errors. Poor diet, inactivity, chronic stress, sleep deprivation, and epigenetic memory transferred from parents. By scientifically correcting lifestyle patterns, we can restore insulin sensitivity, reduce medication, and move steadily towards remission. That is the real pathway to a diabetes free India. How can we identify whether it's type 1 or type 2? Along with blood glucose, check your insulin level. If you're on insulin therapy, a C-peptide test will reveal whether your body still makes insulin. If insulin or C-peptide is normal or high, the problem is not lack of insulin. It is that insulin isn't working effectively. High insulin or hyperinsulinemia can be as dangerous as high sugar level. It drives fatty liver, arterial blockages, weight gain, and even high blood pressure. So the goal must be to normalize both glucose and insulin, not one at the cost of the other. And this is possible only through scientific lifestyle correction. Medicines can lower sugar levels, but they cannot reverse diabetes. Most drugs work by pushing the pancreas to make more insulin, which may keep sugar low for a while, but worsen insulin resistance in the long run. Real recovery begins only when we correct the root cause, our lifestyle. If you have lived with diabetes for years, your insulin receptors may have become dull and unresponsive, like rusted locks that need careful repair, not more keys. Another hidden factor is chronic inflammation. a silent internal swelling at cellular level caused by certain foods, stress, and environmental toxins. It fuels every major lifestyle diseases, including diabetes. Unless we identify and remove these personal triggers, no pill can bring lasting relief. That's why general advice fails and personalized scientific correction succeeds. Ask yourself these 12 questions. 1. Are your medicines or insulin doses steadily increasing? 2. Is your HbA1c still high despite regular medication? 3. Do you take 4 or more tablets daily for sugar, pressure, or cholesterol? 4. Are your kidney reports, especially GFR or urine protein, worsening? 5. Do you feel numbness, tingling, or burning in your hands or feet? 6. Do you often feel exhausted or breathless during normal activity? 7. Have you been told you need knee replacement or joint surgery? 8. Have eye doctors advised laser treatment or injections? 9. Have you noticed a loss of hearing? 10. Do you have fatty liver or early signs of liver fibrosis? 11. Whether recurrent infections bother you? 12. Does your sugar shoot up dangerously if you miss even one dose? If the answer is yes to any of this, your body's insulin receptors are already struggling. And it's time to focus on repair, not just control. At this stage, clinically supported lifestyle correction becomes essential. Our goal should not be to manage disease forever, but to restore normal function and protect the body's organs. This requires two scientific steps. Step 1. Comprehensive testing. Find out how much insulin your body makes, which organs are affected, and what inflammatory or toxic triggers exist. Such data allows doctors to safely reduce medicines and insulin while protecting the heart, kidney, liver, and eyes. Step 2. Regeneration. Medicine cannot rebuild organs, but nutrition and circulation can. With precise guidance, the body's own cells can recover and regain vitality. That is true reversal, not mere control. So ask yourself, do you want to remain a patient forever or begin your journey back to health? If you have tried and struggled, what you need now is not stronger drugs, but stronger understanding, clarity about your condition, and clarity about the scientific path to healing. Think about this. For sugar, pressure, thyroid, joint pain, or heart disease, many people visit 5 or 6 specialists and take 5 or 6 medicines, one or more for each problem. The World Health Organization classified all these diseases as lifestyle diseases. So, are these diseases truly different, or are they different expressions of one single underlying cause? That is what we will explore today. For most people, daily life revolves around tablets for sugar, pressure, cholesterol, pain, or thyroid and fatigue. Health freedom means breaking that dependence, where medicines and surgery are used only in emergencies, not every day. We must understand this simple truth. Knowledge and commitment are more powerful than medication. A life without chronic disease or chronic medication, that is true health freedom. To achieve it, our focus must rest on 3 pillars. 1. Right knowledge, understanding the real root cause of disease. 2. Right application, using that knowledge wisely in daily life. 3. Right evaluation, use scientific monitoring and clinical support. When you become an informed patient, you begin your journey towards a disease-free future. Today, modern medicine divides the body into many compartments: endocrinology for hormones, cardiology for heart, nephrology for kidney, neurology for brain, and so on. Even within diabetes care, every affected organ has its own specialist: eye surgeon for the retinopathy, pediatric surgeon for foot ulcers, cardiologist for heart blocks, nephrologist for kidney, etc. Hospitals grow more advanced, specialties and specialists increase. Yet, number of patients continues to rise. Why? Because the true root cause is rarely addressed. That root cause is chronic inflammation, a slow, silent, smoldering fire that burns within the body cells. This root cause is not addressed for or ignored. This is why conventional treatment only manages symptoms but never end the lifestyle disease. To understand healing, we must understand immunity. Your immune system is your inner doctor. It maintains health, heals wounds, and restores balance. It has two vital roles. One, defense or inflammation, controlled by omega 6 fat, helps defend the body. Two, healing or anti inflammation, supported by omega 3 fats, helps repair the body. When harmful substances enter, whether from unhealthy food, alcohol, pollution, stress, or chemicals, the immune system triggers inflammation to protect you. But modern living keeps this fire burning continuously. Excess omega 6, low omega 3, and hidden toxins in food and environment pushes the immune system into overdrive. And that constant defense mode becomes chronic inflammation, the foundation of all lifestyle diseases, including diabetes. So, if you want to heal, you must learn how to support your immune system rather than constantly suppress it with drugs. Every illness speaks through symptoms: fatigue, fever, pain, redness, or swelling. These are not the disease itself, they are signals from your immune system saying, "Help me restore balance." But many modern treatments simply suppress these signals instead of addressing the root imbalance. When we strengthen the body with the right nutrition, circulation, and rest, the immune system can complete its work and true recovery begins. When immunity loses rhythm because of poor diet, lack of nutrient, or toxins overload, disease takes hold. Our goal is to restore rhythm and balance through lifestyle correction, food, movement, rest, and detox. That is the path to natural healing and freedom from chronic disease. When you injure your finger, the area becomes red and warm. That is acute inflammation, a healing response. But inside many people today burns a hidden, constant fire, chronic inflammation. This silent fire damages the blood vessels, weakens organs, and triggers most lifestyle diseases: diabetes, hypertension, heart disease, arthritis, fatty liver, and more. It affects every organ system. One, blood vessels, leading to diabetic retinopathy, neuropathy, nephropathy, and memory loss. Two, joints, causing arthritis and chronic pain. Three, heart, promoting fat deposits, high blood pressure, and heart attacks. In type 2 diabetes, both high sugar and high insulin damage blood vessels. The disease may seem to affect different organs, but the cause is one: inflammation. Medicines can temporarily suppress it, but cannot remove it. Long term drug use, in fact, can add to the toxin load, burdening the liver, kidney, blood vessels, and immune system. The only way to extinguish this fire is through precise lifestyle correction guided by science. Each medical specialist focuses on their organ. A cardiologist focuses the heart, a nephrologist the kidney, an ophthalmologist the eyes. But who looks at the whole person, the system that ties them all together? Lifestyle, diet, and metabolism, the true root of disease, often fall outside traditional treatment plans. That's why patients keep adding doctors and medicines, yet remain unwell. The gap between disease management and disease reversal lies here. If we correct the common foundation, chronic inflammation and lifestyle imbalance, the entire body begins to heal. This is where the concept of holistic integrated medicine becomes essential. Here, the integrated medicine doesn't mean integrating all different systems of medicine like modern medicine, Ayurveda, Homeo, Unani, etc. What we want is addressing not just the parts, but the whole human being. At first, chronic illness may look complex, but when we look deeper with the science, the solution is simple. Step 1, gather the data. Identify your hidden inflammatory triggers. Measure your nutritional gaps, hormonal imbalance, immune strength, and toxin levels. Step 2, create a personal plan. Based on your data, design a program to help cell regenerate, restore organ function, and reverse inflammation. This is not a one size fits all plan. It's a scientifically guided, individualized lifestyle correction. As inflammation subsides, insulin and glucose level normalize, blood pressure falls, artery blockages regress, joint pain eases, and energy returns. When the root cause is corrected, multiple diseases are reversed. Lifestyle diseases all share one real medicine: lifestyle correction. Type 2 diabetes is no exception. By restoring the body's natural balance, we extinguish the fire of inflammation, reduce excess insulin, and protect our organs. This is the moment to reclaim clarity and health. Let us move from confusion to science, from management to healing. Remember, freedom from disease requires informed commitment built on three pillars. 1. Right knowledge. Know the real root cause of your condition. 2. Right application. Apply that knowledge effectively in daily life. 3. Right clinical support. Secure monitoring and guidance to reverse disease and maintain health. When you become an informed patient with proper support, your journey to a disease-free future begins. Ask yourself if any of these red flags are present. 1. Early symptoms of hyperinsulinemia. That includes weight gain, protruding tummy, darkened skin patches under the arm, around the neck, forehead, cheek, etc., and high blood pressure and cholesterol and triglyceride. Second is failing organ functions. For the kidney, rising creatinine, falling GFR, fatty urine, albumin in urine. For the liver, fatty liver on scan, rising liver enzymes. When we come to the heart and blood vessels, elevated troponin level, HSCR, homocysteine, plaque test. Next is inflammatory markers, abnormal CBC, ESR, CRP, etc. This means cells are being damaged faster than they are repaired. Third, nerve and blood vessel damage associated symptoms. Numbness, tingling, burning sensation, and reduced sensation of extremities like hands and feet. Next is memory decline, hand tremors, leg pain and ulcers. Diminishing vision, hearing, memory, joint pain and degeneration of the joints. Exertional breathlessness, chest discomfort, which means suspected of heart vessel block. These suggest Diabetes has started to injure blood vessels and nerves. Fourth is rising medication load, more pills, higher doses, adding insulin. Medicines can control glucose, but they do not remove the root cause. Side effects may create new problems. At this stage, only clinically supervised intensive lifestyle correction can repair organs and restore health. A common question: with all our medical advances, why can't we cure diabetes? The answer is simple: because most modern drugs focus on lowering blood glucose, not on fixing insulin resistance or reducing hyperinsulinemia, excess insulin in blood. Even when insulin is already high, therapy often adds more insulin to control sugar. Evidence shows chronic hyperinsulinemia injures blood vessels, accelerates fat deposition, and drives complications. Glucose control without addressing insulin resistance and hyperinsulinemia leaves the disease engine running. If you have ever wondered why organs decline despite strict medication and insulin, here is the answer. Most type 2 regimes don't target insulin resistance or hyperinsulinemia. Some even raise insulin further. That fuels 1. Higher BP, kidney damage, nephropathy. 2. Fatty liver, fibrosis, cirrhosis. 3. Arterial plaques, atherosclerosis, heart attack, stroke. 4. Eye vessel overgrowth and vision loss. 5. Links to Alzheimer's disease, Parkinson's disease, PCOS, BPH, it is benign prostatic hyperplasia, and more. Conditions associated in research with excess insulin. Anything in excess becomes harmful, including insulin, glucose, and fat. The aim is to normalize them, not to push any one of them artificially. Hormones like thyroxine, insulin, leptin, etc. are the controllers of metabolism. Deficiency or excess can harm the body. In modern medicine, if there is an excess amount of thyroid hormone, as in Graves' disease, we try to bring it down with medicines. If not possible, remove the entire gland or destroy it with radioactive iodine and then give hormone replacement, levothyroxine, as treatment. That is the norm. See what we are doing in type 2 diabetes, where insulin resistance and excess insulin are present. Surprisingly, treating it by further increasing the insulin level to control blood glucose level, driving hyperinsulinemia to super hyperinsulinemia, simply forgetting the negative impacts of high insulin levels on health. Think, why are we going in the opposite direction? Why are we forgetting the basic principles of life sciences while treating hyperinsulinemia and insulin resistance in type 2 diabetes? Patients, healthcare providers, and authorities should start thinking seriously on this disparity. What we need is a treatment method which takes care of both hyperglycemia and hyperinsulinemia together. That should be the treatment goal. Our goal is to halt damage and repair what's repairable. Lifestyle correction is the game changer because it uses 3 coordinated levers. 1. Nutrition, the fuel and raw material for bodybuilding. Using specialized testing to find your deficits and triggers to supply optimal nutrition to calm inflammation, provide clean fuel, and support cell repair. This helps restore insulin receptor function and normalize insulin and glucose. 2. Circulation, delivery, and cleaning. With a targeted physical activity to improve blood flow, so nutrient-rich blood reaches tissues, clears damaged cells, and builds new healthy cells. 3. Detoxification, to reduce the toxin load, to lower internal toxin burden and prevent new toxins from entering. Long-term drug load can itself strain the immune system, kidney, liver, and vessels. Under clinical supervision, as your test reports improve, medicines can often be safely reduced, allowing your own biology to do efficient repair. Self-directed lifestyle changes are admirable, but if you are on medication for diabetes, hypertension, thyroid, or cardiac problems, do not go it alone. As diet and exercise change, sugar and pressure can drop quickly. Without expert supervision, this can become dangerous. Choose scientific, clinician guided lifestyle correction with a structured monitoring and a clear de-prescribing protocol. Your most critical health decisions should be backed by data and medical guidance, never guesswork. No surgery is risk free. No medicine is side effects free. Multiple medications can give drug interactions related issues and increase the development and intensity of other serious health conditions. Use them when they save life or prevent major harm. For fractures or trauma, surgical intervention is needed. For severe pain, painkillers is needed. Severe infection need antibiotics. Snake bite, anti-snake venom is a necessity. Dog bite, rabies vaccine is needed. Modern medicine is excellent in emergencies, but type 2 diabetes is a chronic lifestyle disease. Its root cause sits in daily habits and metabolism. Drugs and surgeries cannot rebuild organs. Scientifically guided lifestyle correction often can restore function quickly and safely. When we look beyond medicines, the real secret of healing lies inside ourselves. The condition has a hereditary tendency. If either parent has diabetes, the children's risk increases. What's more, diabetes that once appeared in parents only in old age is now seen in their children in youth and in grandchildren even during adolescence. When we think and look beyond medicines, we find that the true secret of recovery is hidden inside ourselves. How can your lifestyle influence the genetic material, DNA inside your cells? How can you send the right signals and guidance to your genes? Let us find out. To overcome hereditary diseases like type 2 diabetes, we should learn the science of gene expression and epigenetics. What is epigenetics? It is the science of the relationship between genes and lifestyle. The human body is made up of about 50 trillion cells. In each cell, DNA, the genetic material, resides in 23 chromosomes inherited from the father, 23 chromosomes and a mitochondrial DNA inherited from the mother. Each person's genetic operating manual is written in the four-letter language of DNA. We cannot change our genetic structure, our DNA, that is your hardware. But through your lifestyle, you can turn epigenetic switches within these genes on or off. This happens through chemical modifications such as methylation and acetylation on DNA and the histone proteins around it, as well as through non-coding RNAs. Think of this as your software. An unhealthy lifestyle creates inflammation, a kind of cellular swelling or congestion. These signals switch on disease promoting genes. In contrast, accurate nutrition and physical activity can switch off inflammatory genes and switch on protective repair genes. In other words, while genes are the hardware, lifestyle can control the software. that determines when and how those genes operate. When we clearly understand these modern epigenetic insights and apply them practically, we gain the capacity to control not only insulin resistance and type 2 diabetes, but also most lifestyle diseases without drug or surgery. Mitochondria are the powerhouse inside our cells. Dysfunction of mitochondria is a major factor in diabetes and many other lifestyle diseases. A tiny mitochondrial DNA inherited from the mother is as important as, or even more important than, the DNA in the cell nucleus. Defects in mitochondrial DNA impair the process of converting glucose into energy. This explains the fatigue seen in people with diabetes, even when they eat and even when the sugar is normal or high. Here, the mitochondria are unable to convert glucose into usable energy. Meanwhile, when our conventional diabetic treatment protocol focuses on increasing insulin levels to lower blood glucose, the excess glucose gets converted into fat in the liver. This excess energy converted to fat should be stored inside the fat cells. When fat cells become overfilled and the storage capacity is exhausted, triglycerides in the blood begin to rise. That is when fat accumulation starts outside the fat cells, leading to fatty liver and chronic liver diseases, atherosclerosis, and vascular blockages, etc. Research now shows that diabetes and cancer share common soil: metabolic dysfunction. Years of poor diet, excess glucose, and excess fat, along with deficiencies of vitamins, minerals, and omega 3 fats and toxins, damages the mitochondria, the cell's power station. As a result, cells are forced to rely on less energy efficient pathways to produce energy from glucose. The metabolic waste generated in this state of create inflammation, a cellular congestion. Hyperinsulinemia, excess insulin levels, mitochondrial dysfunction, and the resulting metabolic waste together nourish cancer cell growth. That's why diabetic patients have a higher risk of cancers of the liver, pancreas, colon, breast, etc. Healing mitochondria through nutrition, physical activity, and detoxification doesn't just control sugar, it strengthens your entire defense system against chronic diseases, including cancers. What must we do? Using epigenetic possibilities, we need to restore the health of our cells and their mitochondria. We must understand its importance. Let us see how lifestyle correction becomes a game changer here. Three lifestyle factors mainly influence epigenetics. First is nutrition. Using precise data from specialized tests, provide the right quantity and quantity of nutrients to reduce organ inflammation and supply clean fuel to the body. This helps repair damaged cells, restore insulin receptors, and normalize insulin and glucose levels. Second is circulation, the blood flow. Through targeted physical activity, improve blood circulation so that nutrient-rich, clean blood reaches the organs, removes damaged cells, and help rebuild new cells. Next is detoxification. The body must be able to eliminate accumulated toxins and prevent new toxin load. The body perceives medication as chemical burdens. They increase the workload on the immune system, kidneys, and liver. Only when we can liberate ourselves from the unnecessary medicines, we can strengthen our immune system, make repair work efficient, and ease the body's renewal. The common belief is that if sugar reports are normal, diabetes is under control. That is not correct. High sugar is only one symptom of diabetes. In the preclinical stage, before blood glucose start rising in type 2 diabetes, insulin level in the blood start rising. The core problem is that insulin, the hormone that regulates metabolism, is not working properly. For the body, glucose is simply a fuel to produce energy. Insulin's job is to oversee the conversion of glucose to energy, and when there is excess, to store it as fat. When inflammation and congestion stops insulin receptors from working, blood sugar begins to rise and pancreas produce more insulin and keep the glucose level normal. This is where diabetes begins. The excess insulin converts glucose into fat and stores inside the fat cells, especially inside the abdomen. Weight gain and abdominal obesity follows. As body fat increases, the function of insulin receptors declines further. The pancreas tried to solve the problem by producing even more insulin. When the pancreas tries and cannot produce enough insulin, or when most of the insulin receptors fail, blood glucose rises. Some people with diabetes find that no matter how many tablets they take or how much they increase insulin doses, the sugar does not come under control. The reason is their insulin receptors are not working. Hyperinsulinemia, high insulin levels, causes health problem as much as or more than high glucose. It plays a major role in fat deposition and block formation in blood vessels. That means from the excess insulin in the pancreas makes in early diabetes to the increase in insulin caused by medications to insulin injection for type 2 diabetes patients. All this can promote fat deposition in blood vessels and increase the risk of conditions related to abnormal tissue growth such as retinopathy, prostate enlargement, PCOD in women, cancers, etc. This is why even those taking proper treatment for type 2 diabetes and keeping the blood glucose under control still develop heart attacks, strokes, retinopathy, nephropathy, neuropathy, cancers, etc. Patients, healthcare professionals, and policy makers must understand these scientific truths and appropriately revise diabetes treatment protocols. We must move from being patient to becoming informed, capable individuals who self manage, strengthen, and improve our health. We should understand that medicines cannot repair ourselves. We should fix our goals. 1. Avoid lifelong medications for lifestyle diseases. 2. Avoid surgeries for lifestyle diseases. And 3. Gain health freedom. This is where you shift from being a patient on medicines to a person in charge of your own health. This is not just treatment, it is a scientific transformation towards health. For this transformation, you need a clear pathway. Imagine your body as a living orchestra. Sugar levels, cholesterol, and blood pressure are just the instruments. What matters is the music they create together. When one instrument is out of tune, adding more medication may silence the sound, but it does not restore the harmony. Lifestyle correction retunes the orchestra, restoring rhythm, not just control. So far, we have learned 1. Type 2 diabetes is not caused by a lack of insulin. It is caused by insulin not working properly. 2. In most people with type 2 diabetes, insulin levels are high. 3. Why diabetes cannot be managed or reversed with medicines alone. 4. Why organs continue to get damaged even when treatment is followed precisely. 5. How epigenetic potential can be used to prevent even hereditary diabetes, and how even those who have been taking medicines or insulin for years can gain freedom from it. 6. How lifestyle correction can influence genetic expression itself and help overcome hereditary diabetes. To prevent diabetes and gain freedom from it, we must clearly understand the science of the disease. Knowledge is medicine. Knowledge gives us the strength to overcome illness. Our goal is a diabetes-free India, diabetes-free world. Across the last 4 parts, we saw every wrong beliefs or decisions in health can create a multiplier effect. One root cause leading to many diseases. The numbers showing how much illness, medication, and surgery can be avoided through lifestyle change are astonishing. These figures will help each of us to decide whether to remain as a patient or become a new healthy person through lifestyle correction. Let us see how the counts of surgeries and hospital stays would change if type 2 diabetes were eliminated. These figures makes it clear that diabetes is not just a sugar level, it damages every organ. Cardiovascular surgery. In roughly 40% of heart-related surgeries, diabetes has a direct role. If type 2 diabetes is removed, the need for such surgeries would drop by 30% to 45%. Examples including coronary artery bypass surgery, angioplasty, and pacemaker implants. Next is leg surgeries and amputations. This is shocking. 50% to 70% of non-traumatic amputations due to non-healing wounds or poor blood flow are caused by diabetes. Eliminating type 2 diabetes could reduce these surgeries by up to 70%. Next is kidney disease. 30 to 40% of the reason for kidney transplantation or dialysis are due to diabetic nephropathy. With the lifestyle correction that eliminates diabetes, the need for dialysis can be reduced by this much. Next is eye surgeries. About 80 to 90% of severe eye problems such as retinopathy are due to diabetes. With the lifestyle correction that eliminates diabetes, the need for these surgeries also will disappear. Next is joint replacements. Among those with type 2 diabetes, 15 to 25% may require a knee or hip replacement. If diabetes is avoided, these surgeries also will decline. If diabetes is removed, global surgical volume could drop by around 35 to 40%. Understand this, along with gaining freedom from diabetes through lifestyle correction, we also gain freedom from organ damage and the surgeries that follows. Another point is infection caused by diabetes. Diabetes not only increases the number of surgeries, it raises the complications associated with surgery. Wound heals slowly and infection risk rises, not only in wounds and skin, but also all infections, including respiratory infections, urinary infections, and genital infections. Think about the financial burden and challenges this creates for individuals, families, and the health system and the nation. Diabetes is defined by high blood glucose. But what happens first is that insulin does not work properly. And to compensate, the pancreas produces more insulin. Pre-diabetic hyperinsulinemia, the state of high insulin before diabetes, high blood sugar appears, can last 5, 10, or more years. In some people with a stronger pancreatic capacity, only insulin is high while sugar may not rise at all. Signs of hyperinsulinemia include hypertension, high blood fat, cholesterol, and triglycerides, dark patches on the skin, especially around the neck and cheek, heart attacks and stroke due to fat deposition in arteries, PCOD in women, benign prostatic hyperplasia, that is prostate enlargement in men, high blood pressure and diabetes in pregnancy, infertility, and cancers. Many of these begin with high insulin levels in the blood. Through lifestyle correction, we can overcome not only diabetes, but also the health problems of this pre-diabetic high insulin stage. Earlier, we looked at surgery reductions related to diabetes alone. Now, imagine the added benefits when we also reverse the hyperinsulinemia related conditions through lifestyle correction. Surgeries decrease further, hospital crowding reduces, waiting for operations and financial crisis due to hospital stays decrease significantly. Think about it. A healthy population is any nation's greatest wealth. If we achieve health freedom, consider the leap in progress and economic growth for individuals, families, and the nation at large. In developed countries, up to about 20% of the GDP is spent on healthcare. A large part of that goes to illnesses linked to hyperinsulinemia and diabetes. This is why this knowledge matters so much. The foundation of health is 98% lifestyle, only 2% is medicine and surgery. Yet, developed nations spend up to 20% of the GDP on drugs and treatment. Now, ask yourself, will you correct your lifestyle and gain freedom from disease, or remain as a patient taking medicines and insulin injections? Everyone, especially those on long term medicines, should understand how medicines affect immunity. Except for vaccines and antibiotics, most medicines provide relief by suppressing immunity in one or more ways. That means many drugs adversely affect the immune system. As a result, people who take such medicines for long periods may have higher risk of infection and cancers. Medicines also increase the workload of the liver, kidney, and immune system. The medicines we consume are excreted as waste products through our excreta, urine, stool, and sweat, eventually entering rivers, drinking water, plants, and food. In other words, the drug taken by each person become a threat to all living beings and our environment through water. Therefore, it is essential that we identify and correct the lifestyle faults that cause lifestyle disease and gain freedom from medicines to protect our future generations from the dangers of drug pollution. This cannot be done by one person alone. It demands a collective effort by the society. Once lifestyle disease such as obesity, hypertension, high cholesterol, heart attack, stroke, and diabetes were mostly seen after the age of 60 or 70. Today, we see them in young adults and even in children. Why? The illnesses like overweight, high blood pressure, high sugar, high fat, and thyroid disorders in parents are being transmitted to children. Defects in DNA from the father's sperm and mother's egg, along with epigenetic changes, are at the root of many childhood diseases. The copy of parental health problems, obesity, high blood pressure, high sugar, high fat, is reaching children. High blood pressure and diabetes in pregnancy causes epigenetic changes, modifications in the baby's cells. Modern studies shows that the seed of lifestyle diseases are passed from parents to children even before birth. In the early years, Children learn and follow the family's parents' lifestyle. Therefore, not only genetics, but also the lifestyle also children inherit from parents. This is why the obesity, belly fat, hypertension, high sugar, and heart disease that affected parents in old age are now seen in the children in youth and in grandchildren during adolescence. Before having children, every couple should ask, am I healthy enough to give birth to a healthy baby? Do not limit health metrics to blood glucose, cholesterol, and blood pressure. Those are basics. Today, we can measure health much more deeply. Body composition, blood nutrient levels, hormones, toxins, cellular inflammation level, and even very early cancer changes can be detected much before cancerous growth is detected on scans. Knowledge is the path to health. After understanding your health status through modern diagnostic tests and preparation, only when you are confident of good health, you should plan for parenting the next generation. Understand the scientific truth that proper planning and preparation can prevent pregnancy related diabetes, hypertension, abortions, etc., and birth defects in children to a great extent. Everyone must know that many childhood health problems begins with parental lifestyle related genetic and epigenetic changes. Only then we can create a healthy new generation. Remember, the key to child's future health lies in the genetic material inside the parent cell. The greatest wealth we give to our children is our DNA and genetics. Wrong lifestyle damages and degrades the genetic material. Only a baby formed from a healthy sperm and a healthy egg can be truly healthy. Each person and couple has the duty to protect their DNA, avoid lifestyle factors which make it damaged and disease prone, and take care. You pass it to the next generation, your child, in pristine condition for the good health of your coming generations. Every couple should remember this. The most encouraging news is that most epigenetic defects caused by wrong lifestyle can be reversed in 3 to 6 months through scientific lifestyle correction. And we can gain freedom from lifestyle diseases such as type 2 diabetes. When aiming for freedom from diabetes through lifestyle correction, first understand what lifestyle really means. There are four main components. One, food and nutrients. Two, activity, both mental and physical activity. Three, rest, both mental and physical rest. Four, freedom from toxins. The scientific aim should focus on ensuring the right amount of nutrition, right amount of activity and rest, and to eliminate toxins. The key challenge is how to implement lifestyle correction in a practical and effective way. Structurally, the body has two major components, fat mass and lean mass. Lean mass means everything non fat, including muscles, bones, blood, etc. Fat plays a central role in regulating body functions. The brain and nerves are primarily made of fat. The membranes of all cells and the organelles are made of fat. Hormones such as leptin and adiponectin released from the fat cells work alongside with insulin to regulate appetite and metabolism. Newer study shows that in people with obesity, leptin levels are high and leptin resistant accompanies insulin resistance, creating health problems. It's not just the amount of fat, but also the type of fat that matters. Fat comes in four types: omega 3, omega 6, omega-9 and saturated fat. Omega-3 and omega-6 fat regulates the immune system or controls the immune system. Omega-6 drives inflammation and defense, while omega-3 enables anti-inflammation and healing. The immune system functions best when the ratio of omega-3 fat to omega-6 fat is 1:1. In today's diet, inflammation promoting omega-6 is excessive and healing omega-3 is very low. In addition, saturated and hydrogenated and trans fats are higher. Low omega-3 along with excess omega-6 and trans fat and hydrogenated fat damages insulin receptors, causing hyperinsulinemia and disrupts the balance of hormones like leptin and adrenochrome. In short, excess body fat stored in the body is the root cause of diabetes and related diseases. When the ratio of body fat to lean mass goes wrong, disease begins. In most people with diabetes, fat mass is very high, while muscles and bone are depleted. Therefore, scientific lifestyle correction focuses on rebalancing body composition, lean mass fat mass ratio through diet and exercise, and restoring the omega-3 fat to omega-6 fat ratio to 1:1, which regulates the body's chemistry and immune system. The body's dharma or duty is to perform physical and mental work. The only body part we can willfully activate are the skeletal muscles, the muscles attached to the bones. All other parts of the body, including the muscles like heart muscles, are working voluntarily. The human body has about 650 muscles and 230 bones. When we stimulate muscles, we also stimulate the bones connected to them, increase blood flow, and release myokines from the muscles and osteocalcin and other hormones from bones. These hormones activate insulin receptors and boost mitochondrial energy production. Only when all muscles are adequately stimulated through regular structured exercise can blood reach every cell, delivering nutrients and removing waste. To keep body composition and hormone balance optimal, we must stimulate muscles and bones through physical and mental activity in an optimal pattern along with optimal nutrition. Knowledge about health is the greatest strength of an individual, family, nation, and the humanity at large. When everyone receives accurate health knowledge, it brings great change. A diabetes-free India should be the natural continuation of our tradition and ancient wisdom. When we examine the role of lifestyle and medicines in health, it is 98% lifestyle and only 2% is medicine. When each person takes the responsibility for their 98% and changes lifestyle with the scientific support, the burden of lifestyle disease falls. Pain and discomfort reduce. Hospitals become less crowded. Treatment costs comes down. Quality of life improves. Life becomes more enjoyable and happier. When such individual victories accumulate, a society with a low burden of lifestyle diseases becomes a model for the world. In this way, India can be the pathfinder in health. Number one, the first type 2 diabetes-free nation, India, Bharat, should become the role model for all nations. We often assume that the doctors and hospitals are responsible for our health. Remember, in your health, the role of hospital, doctor, medicine, and surgery plays only 2%. The rest 98% of your health depends on your lifestyle. How do we measure whether your 98% is right. Where do traditional measurements fall short? Conventional care measures only the level of disease, blood sugar, cholesterol, etc. When medicines reduce these numbers, we think our disease is controlled. But if your numbers are better while you still have the fatigue, pain, and other illness, are you really in control? No. Traditional methods cannot measure the health of your cells. Our aim is to change the cells themselves. So we must measure not only disease, but also the return of health. With the new testing methods, we can identify which organ are affected, why disease rose, what lifestyle correction can change, how much progress is occurring, and how far health has returned. We must track reductions in cellular congestion or inflammation. When your fatigue decreases and energy rises, it is evidence that the cell's powerhouse, the mitochondria, are being repaired. We stand at a crossroads. Remain a patient or become a new informed person. The most important investment in your life is to gain knowledge, to free yourself from misconceptions and gain the strength to make safe, wise decisions. Correct scientific knowledge is the key to health. Use it to open the door to health freedom. Another important aspect is when someone is talking about the healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later, I resigned from the government service and in 1997 started practicing as consultant at Life Care Center, Thyroid, Kochi. I focus on lifestyle modulation with clinical support, minimizing medication and surgical interventions for lifestyle diseases. The time has come to rethink how we view diabetes. Taking medicines for life is not the solution. Understanding and correcting lifestyle at its root is the solution. Let us unite doctors, patients, families, and policymakers to build a future where India leads the world, not in diabetes numbers, but in diabetes freedom. Share this message with everyone you know because every informed person becomes a step towards a diabetes-free India. The answer does not lie in more tablets or surgeries. They lie in knowledge, discipline, and scientific guidance. To learn more about diabetes, metabolic health, and clinically supported lifestyle correction, visit our official website or explore the other videos on this channel. Together, let us replace fear with knowledge, dependence with empowerment, and illness with well-being, which develops a confidence in correcting one's own health destiny. As we close, remember this truth. Type 2 diabetes is not a life sentence. It's a message from your body asking for balance. By listening to that message and responding with knowledge, discipline, and support, we can change the course of global health. Let India lead this movement of hope. Let each of us be a living example that prevention is possible and reversal is real. Together, let us build a future where our children inherit not a disease, but a science-based culture of wellness towards a diabetes-free India and a diabetes-free world. Thank you.